Welcome, everyone. So good to see everyone here. This is our breakout session on the mental health impact of infertility. My name is Sarah Thompson. I'll be your moderator today. I'm an 8-year breast cancer survivor and a Washington state leader for Young Survival Coalition. Please visit our website if you haven't already at youngsurvival.org for resources and additional information. So before we begin, I'd like to review a few housekeeping items. This workshop is being audio recorded, and the session will be available on demand for 30 days for those who are registered. We will have time for Q&A. And I don't see the Q&A on this Zoom. So if you don't have a Q&A chat, go ahead and put your questions in the chat once that session begins. For those who are on the phone, feel free to unmute yourself to ask your question during the Q&A session. And finally, an evaluation survey will be emailed after the summit. 50 summit attendees who have completed their evaluation will be entered into a drawing to win one-on-one beauty session with courtesy of Lipstick Angels, including a box of personalized, clean, non-toxic beauty products. So without further ado, I have the pleasure of introducing our speaker, Dr. Tanya Wood. Dr. Wood is a licensed clinical psychologist who has nearly 20 years of clinical and teaching experience. Throughout her career, Dr. Wood has worked in a variety of academic, community, and public sector settings with a particular focus on providing quality services to marginalized populations, and has a private practice in the greater Los Angeles area with an emphasis on relationship, women's health, and infertility. So welcome, Dr. Wood.
Thank you. Thank you, Sarah, for that introduction, and good afternoon, late morning for everyone who's joining us this session. So my pleasure to be with you to talk about this probably sort of less often talked about subject about mental health and infertility. And I think both of those in their own rights are not talked about very often. So I'm very glad to be a part of this conversation for you today and with you today. So I'm going to share my screen here and start off and just to give a little bit of overview of the agenda and what I want to try to cover. And I don't want this to come off as too much like a lecture. I really want this to be a conversation on this topic. Recognizing that there's so many sort of different aspects to it. But what I do want to cover, just to give a brief overview from an agenda perspective, is the psychological aspects of infertility, kind of broadly for anyone who is in the family planning process, and what kind of emotional, social experiences that they have with that. And then talk specifically about breast cancer and infertility and sort of any added sort of emotional aspects that come along with that, some of the stressors related to infertility and fertility treatments, the different kinds of counseling that is available, and then ending with some tools and techniques that hopefully you can take home with you today. So hopefully you'll have two or three take-home messages, as well as 2 or 3 action items that maybe you can take with you after our time together. So just to kind of start off, and I actually want to talk about this broadly because in preparation for meeting with you today in our conversation, there actually looked at data that the experience of breast cancer survivors who deal with a potential risk of loss of fertility really resembles and is very similar to the emotional response of infertile women or couples or individuals dealing with infertility who did not have a diagnosis of cancer. And so I think that's an important aspect to make, because I want to emphasize that the process of infertility alone brings about its own psychological aspects, and that what's similar across that is that distressing quality of ambiguity and uncertainty. And so there's a large aspect of like just dealing with infertility regardless of how you landed at the place of infertility, that's very similar for everyone. And so probably not surprisingly, it's a very stressful time. And again, like I was saying before, probably what's most stressful is that sense of ambiguity and uncertainty about the future, um, a sense of depression, and particularly around, I think, grief and loss. And in my work with individuals and couples, we talk a lot about the loss of the narrative that individuals and couples had about how they were going to build their family, what that process was going to be like, and the story that was told in their heads from childhood about what that process was going to be. So the loss of that, as well as sometimes just the very physical loss through miscarriage or pregnancy loss, or loss of sort of your physical abilities within reproduction. So there's a lot of grief and loss that can lead to depression as well as trauma. And I think this is a part that we're beginning to focus on more in this field, but that a lot of the experiences can resemble the kinds of traumatic responses that people who have gone through trauma experience. So in the sense of that sort of threatened sense of who you are, and reminders on a daily basis, and it kind of brings about those same kind of experiences. And so more and more we're talking about the sense of trauma related to infertility, as well as grief and loss, anxiety, depression, and stress. And then, oh, sorry, I went too quickly with my slides here. And so that the slide previously spoke to just kind of infertility in general and the kinds of things that I see, regardless again of how you arrived at that place in family planning, of using fertility treatments, having to consider third-party reproduction, et cetera. But I wanted to now kind of hone in on and focus specifically for individuals who've had a diagnosis of breast cancer and are surviving or thriving after breast cancer, and what that means in terms of fertility. And I think at the time of diagnosis, prevailing themes for, especially for young adults, survivors, is infertility is usually one of the number one concerns. And in the moment, there's probably this sense of like, I really have to make this quick choice right now between my own mortality and life and physical well-being versus fertility. And in looking at what kind of themes show up in young adult survivors, is this perceived forced choice. I've got to do one or the other. And I don't have much time to make this decision. So this other idea of feeling sort of cheated out of time, whether it is time to make the decision or time of the future, and that sort of sense of like that all of this has to happen with some sort of sense of urgency, and that is in and of itself very distressing. Another theme that emerges is this idea of sort of life aspirations and future life aspirations sort of suddenly lost or seemingly lost. And that having to kind of, while being very grateful for your health and well-being and life, but also having to navigate any changes that come about from that too, at a time when you weren't thinking about that just yet, right? And hadn't been prepared to think about that just yet. So this idea of sort of life aspirations suddenly lost. And then this other added component of social gender identity. And again, I think from both ends of whether it's from the diagnosis of breast cancer and or the diagnosis of infertility, and how much of gender identity can be wrapped up into both of those things. And so that sense of questioning and loss and reestablishing gender social identity around these diagnoses becomes a central theme that individuals are faced with. And then lastly, the meaning making of decisions. And again, in the literature that I was looking at, the research I was looking at in preparation for today, is that there's been a lot of decision making around health and wellness and treatments along the way that people have had to make. And on the other side of it, we want to understand and make sense of those decisions, and maybe even along the way, the process. And it's I think in my work, in terms of the mental health piece of that and the psychology of it, is what do we hold on to and making those decisions. And in my work, I do what's called acceptance and commitment therapy, which talks about making value driven actions and kind of focusing on like, what do I want my life to be about? How do I want to define my life? What meaning do I make of this? Because that can seem to be lost in the shuffle of all of this because of the sense of like urgency that you feel and or an individual may feel, and the idea of like my future isn't going to look like what I thought, the way I build my family isn't going to look like how I thought. So what do I hold on to in this moment? And I feel like I'm talking a lot, so please, I think um oh, thank you, Catherine. I'm checking. Catherine has added a question. So maybe I can get really distracted because I like the back and forth. So I'll go through my slides and then we'll come back to the questions. Um, so now I want to talk about like the fertility treatment related stressors, and these may be things that you have. And I know that joining us today are survivors, thrivers, as well as care family members and loved ones. So I want to acknowledge that. But for all of us that are here today, probably you previously have experienced some of these stressors already. And when I talk with individuals who are in the family planning process and using fertility treatments, I talk about this in some ways to help reduce the sense of isolation and loneliness that can be associated to some of the treatment related stressors that has nothing to do with you, the individual, or your family. Right? It is just about our healthcare system and how it's designed and how it's established and access to care. So access to care is a huge one, especially with infertility. It's often very expensive. We don't always have insurance coverage for it. And depending on where you live in this country, there may be difficulty finding a provider to provide different fertility treatments. So there's just that sort of access to care can be a treatment related stressor, as well as just the treatment itself. There's a lot of different medical terms and terminology and medications that are used. The process of going through it can be very emotionally painful, physically painful, and even like embarrassing. And oftentimes individuals and couples going through fertility treatments keep that information to themselves because they feel like I should have known this about my body, about myself. I should have known this about reproductive health. But it's something we don't talk about enough for people to be well informed, to understand what the treatments are and how they're helpful, or what potential side effects will come from it. There's a lot of hormonal treatments that are used, as you all probably are very aware, which come with a lot of like psychological and physical side effects, a lot of emotional changes that individuals will go through. And not always being informed or prepared for that can be kind of jarring for individuals who, again, feel like, what have they done in this process? And sort of feeling responsible for even their own response to the medication, because in absence of knowing like to expect this and anticipate this. And I think the other part of sort of treatment challenges um, that individuals and family members who are supporting individuals can face is just the kind of lack of attention to all the holistic need of individuals going through this. You know, we can attend to the medical, physical, but we do forget about the psychological, the mental health, sleep and rest and relationships and all those things that can become affected by and intertwined with using these treatments. So I say all this not to scare anyone, but also just to kind of bring about like these are the things to be aware of. Wherever maybe you've already encountered some of this, and it's like, okay, yeah, like again, these are external to individuals. These are like more systemic things that we can actually probably do something about, that we don't have to take the burden of responsibility feeling like it was us and shortcomings of us in our response to this. And so when I talk with, as an individual psychological provider of mental health, I talk a lot with hospitals and reproductive endocrinologists and fertility clinics about how to reduce some of those barriers and treatments that I just talked about on the previous slide. And A lot of this can be done at the forefront, just thinking about providing patient-centered care. And so even though I usually talk about this to the providers, I want to talk about it today in our session because I think it can help individuals arm themselves with information about like how to enter into this um, world, especially around infertility, with some, again, some strategies and tools for yourself. So the first is really like information gathering. And again, providing as much information and knowledge so that people can make informed decisions. And kind of back to that theme that I mentioned before, that one of the themes for individuals diagnosed with breast cancer is this like, you know, shortened forced choice decision making, and give a person as much information at the outset. Sometimes we don't know what we don't know, and we don't know what questions to ask. And then on the back end of it, we can feel like, well, I didn't know that was even a possibility of consideration. So at the forefront of all of this, we can begin to try to provide, as providers, oriented around sort of providing patient-centered care, thinking about what information does my patient need or what does my client need right now, and how does that inform their decision making. So what I would say, how you can arm yourself is like, what do I need to know? If this was you going through this, if this was one of your loved ones going through this, what information would you want them to know before they make a decision about choosing ABC in terms of their care? So that's sort of patient-centered care more broadly. And then there's infertility, specifically infertility counseling, which gets at things like, again, that implications in decision making. Like, what will be the impact of this on my reproductive health in the future? What the supportive counseling as people are making decisions about what types of infertility treatments they may use, and or what supports they need to get through that. And then crisis counseling. And for the infertility process comes with its own up and downs and challenges. And so in those moments, having someone available to kind of give support and information in those moments after disappointments or failed treatments or additional losses. So there's specific infertility counseling, and then there's psychotherapy. There's just a more broad therapeutic counseling that maybe addresses some of those other um, deeper implications I mentioned before, like the anxiety and depression. So now individuals are beginning to see that this is affecting their ability to work and their focus and concentration. It's disrupting their relationships, and they're maybe more angry than they have been before. So then psychotherapy to address all the other pieces too. So you may not need, an individual may not need all of these or may need all of these, but I think I'm hoping that this gives you a sense of being able to think about like, what are my needs in these moments? Do I need something very specific to infertility, or is there something broader that would help me navigate all the aspects of this? And again, I want to, okay. I'll keep going again. I can get so distracted by the questions. So I said I wanted to end like tools and techniques for individuals. And so mastering your mental health. So, going through this is emotionally challenging. There's lots of different emotions, not all negative. There's also like hope and possibility and joy that can be experienced. And in my work, and I mentioned acceptance and commitment therapy, and this part of it is about understanding your values and what you want your life to be about, so that you can anchor decisions in that. And the other part of it, though, the acceptance part, is about being willing to experience your emotions. And when I talk with my clients introducing acceptance and commitment therapy, the acceptance part on the surface can be a bit misleading, because I make sure to clarify that the premise of the intervention or this framework of therapy is not to say like, I'm just going to accept that bad things have happened, or accept, that is not at all. It's more of saying like, no, when bad things happen, we feel some kind of way. And we're really good as humans of trying to distract ourselves from those unwanted emotions. And so the acceptance part really is more about being willing to accept all the range of emotions that come up and attending to those, because they tell you that this is something important to you. If I tell my clients, if there is an emotion that you're feeling, whether it's anger, anxiety, what's behind that? That tells me that there's something in this that's important to you and of value to you. So being willing to experience emotions is part of mastering your mental health. And two ways to kind of do that, or two ways to kind of build a system for to manage that, is first your own self-monitoring skills, right? Increasing capacity to tune in to our own thoughts, emotions, physical sensations, reactions. And I'm kind of curious right now if people can kind of check in of how they're feeling right now. Like, um, is this bringing up anxiety? Is it um, bringing up confusion? Or is it kind of comforting? It's like, okay, these are the things I've been thinking about. This sounds like, seems consistent with what people going through this would be. So just being willing to kind of check in to how we are experiencing and responding to things in the moment is an important part of being willing to experience your emotions. And then the other part is building a caregiving system. And by that, I mean, like, who and what are the supports around you that can reinforce any coping strategies, healthy, effective coping strategies that you want to use that will really facilitate self-care and wellness. And for myself, I've even created like a self-care menu, because I think about, like, there are different times when I'm managing different kinds of stressors that I need different things. There's times when I need to bring up my energy level, and I need some activity to kind of you know um, raise me up. So I have a happy music playlist, I have a dance music playlist for those moments. But there are also times where I need to kind of rest and rejuvenate, and I need a bath, or I need a hot tea. And it's important for me to know when I need those different things, because sometimes we talk about this idea of self-care as though it's sort of this, like, one size fits all. And it's like, okay, yeah, go to the spa. And I'm like, there are things that going to the spa won't really be as helpful for me as much as, like dancing it out in the living room with my dog. Um, so that's what I mean by building a care, and which people will help facilitate that, right? I know which friends to call when I need one of those things. I know the friend that will take me out to lunch. I know the friend that we can go to the park, and those are different people, and that's okay. And it's great to know what that caregiving system is and how it looks. And then coming into my last couple of slides before we get to actually conversation and questions. So I also think about this in terms of building like this caregiving system and a fabric of self-care. There's actually this line of work in trauma treatments. I remember I do use somewhat of a trauma-informed perspective when talking about infertility, that like what's important to in our self-care is to build what's called a fabric. And the metaphor fabric is very intentional here, because a piece of cloth as a fabric has much more resiliency and strength to manage sort of stressors rather than like individual threads. So the individual threads can maybe break under pressure or be more fragile under pressure than an entire network of threads together. So the network of threads build a fabric or cloth. So if there are things, and hopefully these are some sort of action items that you can think about for yourself and your loved ones and your family, is again, information. Information is power. So being informed, being willing to ask questions, ask what you don't, again, sometimes we don't know what we don't know, but then say, like, what would you want? If you were in this situation, what would you want to know? How would you be able to make this decision? So get information, develop those routine, consistent coping rituals. We sometimes forget just how important the daily things of caring for ourselves through eating, taking a bath, taking a shower, getting dressed. Just those daily habits and routines are really important for setting up sort of that consistency in our lives, so that when things come at us, we have those in place already. Also, prepare and anticipate difficult situations. And again, thinking about this from the fertility and fertility perspective, I talk about this with my clients of like, you've been invited to this baby shower, and those can be one of the more like sort of depressing, traumatic, anxiety provoking situations. So we know what kind of emotions you may have, and you really want to go support your friend at this baby shower. So let's anticipate what that's going to be like for you. So let's go ahead and prepare for what you will need during that. What friend can you take with you? And what code word can you use when you like need to bolt? You know, what will you go into the bathroom for 5 minutes? Like prepare for that difficult situation. So anticipate difficult situations and prepare in the moment strategies. You know, so what's in your pocket that you can do in that moment? Like again, is it a playlist on your phone? Is it a quick 10-minute or 10-second deep breathing activity, something in the moment that you can do? If you get caught off guard, like, oops, I didn't expect this to happen. So what can I do now? Again, I mentioned already building a caregiving system of people, supports, resources around you. And then I think most importantly, ask for and accept help. Be willing to accept and be open to accepting help from others. So my last slide, before we get to our conversation, I love this quote by Maya Angelou. We delight in the beauty of the butterfly, but rarely admit the changes it has gone through to achieve that beauty. So it's just a reminder that all the things that we've gone through have led us to who we are and the strength and resiliency that we have. And sometimes it can feel like it's one thing after another, and it's like, okay, I got through that. Now I'm about to get through this, and that is what we encounter a lot with infertility. But that, you know, recognizing that it's the changes that we've gone through that really help us achieve the beauty and strength of who we are. So I'm going to stop sharing my screen. I feel like I was just talking boom, boom, boom.
That was great, Dr. Wood.
Thank
No,
you.
so much good information. And we do have some great questions and situations that people are sharing in the Q&A. So let's see. I think, the first question was, could you talk about leaving a legacy without children? Thank you.
Yes, now that is a great question, and I saw that earlier in the chat, and you know, it again, using the perspective I use about values, it sounds like legacy is a value. And sometimes this idea of family planning is that the family we have will be our legacy. And yes, how can you do that without children? And I think it's about like, so continuing again to think about what are the other values that we also have? What are the other parts of ourselves, other identities that we have that can be part of that legacy? So is it something about in this work and contributions to others? So I do think it opens up the understanding that we are complex beings with multiple facets of who we are, and our legacies can touch on all parts of those identities and pieces of who we are. I'm hoping that makes sense. Yeah.
And then someone asked about, surrogacy. Can you discuss surrogacy or emotions around that, or what are your thoughts?
Yes, absolutely. I think that could be a whole nother hour all on its own. You know, and in the same way, the slides that I already mentioned, I think that, and I don't know which specific parts of surrogacy, but I would say that, you know, by the time a person has arrived to consider surrogacy, there's been that trauma and loss already, right? The loss again of the idea of pregnancy and parenting and how the family building process would look. Um, so I think I often speak to allowing ourselves that time to grieve that and being okay with that. Um, and then the process of finding a surrogate, you know, whether you want to use a known surrogate, so a family member and or friend, or go through an agency. And there are benefits and advantages to both. And I do a lot of consultation with individuals and couples who are considering surrogates and or donors. And there is no one right answer to any of that. It really is best about what you feel like your own individual and family needs are. You know, sometimes for an unknown surrogate through an agency, it's just like it can feel kind of just cleaner and easier and different. You know, I mean, not different, that's not the word I want to use, but just cleaner. It's just kind of like, you know, this is just a transaction. You're the vessel, and that's what we will need you for in this family planning building process. For other people, having a relationship with a surrogate is also important. So it really is about like understanding yourself and your needs, and knowing there's no right or wrong in any of that at all. Um, and just be prepared for, yes, there's a lot of emotional piece, but there's also like a legal technical piece to it too. And I in my work with individuals, couples, I at the outset, I kind of like give that disclaimer, and I somewhat apologize because I'm like, I'm going to talk about this in a very technical way. And that's not because I don't understand um, the level of attachment and investment and emotional, involvement this has, but there also is this very sort of legal technical aspect of it too. But throughout all of it, you are the parent, you are the intended parent. And I'm going to talk about it in that frame too. Um, and and I say, and your parenting starts right now. So you're able to say, like, this is what I want. That is, your parenting has already started in the moment that you think about the kind of environment that you want your child conceived in. So um, anything that you want to ask for is okay. So again, I don't know, we could do a whole nother session on surrogacy alone, but hopefully that's touched on and gave an answer to folks.
That was great. The next question is, or more statement is great. Trying to work up emotional reserves to start the process. I'm thinking that fertility treatment process, and there are big emotions standing in the way. So
Absolutely, absolutely. Yeah, and we don't know when those emotions will show up. It can be at the strangest times, like in the doctor's office, watching a commercial. Yeah, Mother's Day, Christmas are always the most difficult holidays because of things. This, the reason I say Christmas is because of the holiday cards that show up in our mailboxes. And you don't think that will be the time the emotion will show up, which is why I say so much of this is being willing to experience and express those emotions. Um,
gotcha. And Dr. Wood, what do you say to people who diagnosed with breast cancer, very young, under 30, trying to connect with friends who have secondary infertility. So they already have one child and they're having that secondary infertility with their second or third child, and not really being able to have a connection because they're saying they understand you, you know, but how do you handle that? How?
yeah, that it is. It is not easy. It is tough. And it's the nature of the question itself is so generous, because what I hear in the question is, how do I handle those friends of mine who are saying, like, I understand what you're going through, while they already have, they're doing secondary infertility. So they already have a child conceived somehow. And they don't understand. I mean, like, and that's true whether a person has arrived at infertility or secondary infertility, regardless of how they arrived at it, right? Like, everybody's journey is very different and unique. So maybe a way to handle or respond to that is say, I really appreciate the effort and that you're, being here with me, but all of our journeys are so different and unique, and it is a little different. Um, and there may be aspects of it that you can understand, but there's another part of it that you won't ever be able to, because my journey is just unique for me.
Sometimes it's having that conversation
So having that
with the
conversation,
person.
yeah,
Yeah.
yeah.
Our next question, are there recommended databases or resources to better understand infertility risk based on age and cancer treatment? I know that Livestrong Fertility Program, they have a great resource online, but do
Mhm.
you have any other resources for folks to tap into?
Yeah, that's a great question. And I know that in the infertility world, there is a database for broadly about treatment results and treatment outcomes. And I don't know for sure if it does specifically adds information for individuals diagnosed with breast cancer. So I apologize for that. I don't know specifically. Um,
No problem. And let's see, any advice on how to talk about these things with family and friends who just don't get it? I guess people saying like, just adopt or
oh
just
gosh.
get us, the gist.
The just be grateful, just be You know, I'm going to give a sort of a two-part answer to that, because I want to be like honest and real with you, because they just won't get it, and they don't, and they mean well. They really do, and they mean well. Um, but it's hard for them to understand it. And in part, this was why I went into this field as a psychologist. Specifically around infertility, because I dealt with infertility myself. And as a psychologist looking for a mental health provider while going through it, I couldn't find anyone who could relate. And I realized there was a gap in that. And family members and friends are very well meaning. Um, but I think that you have the right to protect yourself, and build that caregiving system of those people that you can go to who um, will just be able to provide what you need. And I think so. My first part of it is it may be hard to change them. But that doesn't mean, but you don't have to change, but you can seek out those who will be able to just be with you. And I think part of that conversation is, you know they may have their own feelings about this, and how much of what they're saying is truly their own anxieties and worries and fears, because they don't know what to do. They don't know what to say. They don't know how to be helpful. And that is okay. And you can say, like, well, this is, and tell me what you need. What I need is just sit with me. Just, be with me. I don't need you to make it better. I don't need you to solve the problem. I just need you to be with me. Um, and and if you need someone to talk to you about it for yourself, then find that person for you. Because I think a lot of times they're trying to help us by relieving their own stress. And it's like, no, 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 that's actually not as helpful to me.
Makes sense. And there is another question here specifically about how to ask your oncologist and fertility doctor to collaborate, right? So that there's the best possible
Mhm.
chance of success for treatment.
Yes, especially because they're going to be operating from pot- two different sort of goals potentially, and they may see their recommendations as in conflict with those goals. Um, so I would say how to advocate for yourself, and that is bring it up and let them know, like, while this may be presented as an either or, I really want this to be a both and conversation, because that is important for, honestly, how your mental health and emotional well-being during the cancer treatments, is just as important. So it's like, I will be better prepared to manage emotionally these treatments if at the same time I am also considering and thinking about the impact on my reproductive health and fertility. So this is a both and. So maybe with the oncologist, it's like we need to have this holistic um, conversation about me as a whole person. Um, and I can kind of sound a little extreme sometimes. I apologize, but like I fired a couple of doctors a couple of times. Like, and if that's going to be uncomfortable for you, I may have to look for someone else who's willing to collaborate in that way. And you can find a person who will collaborate with you in that way. So that would be my short answer. Instead of a either or, it's a yes, it's a both and conversation.
That's a good point. If someone was interested in counseling, how would they go about or finding support in that way? How would they go about finding the right counselor or person for them? Where do you start?
Where do you start? Yeah.
Yeah.
And so if especially specifically to infertility, resolve.org is a great resource. It's an advocacy group around infertility and family planning. And they have state by state, they provide a listing of mental health providers, as well as a lot of groups and peer-led groups for individuals. So that is a great, I think, resource to start. Um, Broadly, the American Society for Reproductive Medicine is another place to look for a provider as well. I think those would be the main two that I would recommend. And once you touch base with either of those, we're a small but growing network, and then we can help identify a good fit for someone within that.
Wonderful. Well, I think that's the end of our session
Oh my
here.
gosh, it went by so
It went by
fast.
quick. I know. Thank you, Dr. Wood. That was a great talk and all the questions, and everyone who's here on Zoom with us. You know, had such great questions, great insight, and I love that everyone's kind of chatting and supporting each other, and that's kind of what we're here for, right?
Yes,
Is to support.
find your village, find that
Mhm.
caregiving support and system of individuals who do understand and know, and it's not, that you can talk to about these things.
Yeah,
Absolutely.
wonderful. Well, everyone, head over to the main stage for yoga next and mindful self-compassion for well-being. You can click on your YSC logo at the top left of the event page to return to the main stage, and then I'll post the schedule link as well. So it was good seeing everyone.